Hi, I'm Dr. Matthew and I'm from MVP Family Dental. We get a lot of questions here about Invisalign, so I just wanted to address some of them for you today. Invisalign is a way to straighten your teeth without the traditional metal braces. So basically you wear clear trays and there's a succession of them, there's a series of them that you wear, and they basically straighten your teeth over a period of time. Invisalign can be about the same speed as braces. It depends how compliant the patient is. You know, if you're wearing your trays, you got to wear your trays. But it can be just as fast as braces, if not faster than braces. I believe that Invisalign is more comfortable than braces because braces have metal and you have that wire that can stick out and poke you in your gums, and then you need the wax for your braces. So Invisalign is just clear, smooth trays that go over your teeth and you can take them out to eat. So that's even better because you can eat whatever you want. You don't have to have any limitations on what you eat. And then you brush your teeth, floss, and put them back in. So I really think that Invisalign is a more comfortable option. So Invisalign is designed to be worn day and night. You should be wearing it at least 22 hours per day, which means you wear it when you sleep. The only times you take them out is when you're eating and brushing, and then you pop them back in. Just like how you would wear regular braces, you know, you wouldn't be able to take those off. So this is the same idea, except you have a little bit more flexibility because you can take them out when you want to eat, and then you have to put them back in though. Invisalign is not painful. The first week can be, you know, an adjustment period, but other than that, I haven't had patients complain of pain or problems with wearing the Invisalign. And we're always here to help. If there's any issue, we can help with that. So the process involved with Invisalign treatment is you would come in for a scan of your teeth, which is like a digital impression of your teeth, and then we can actually show you how your teeth look right now and do a simulation to show you how they could end up after Invisalign treatment, which is a really cool feature of this scanner. And then once we agree and everything's set, you know, we start the Invisalign by putting these attachments on your teeth, which will come off at the end of treatment. They're tooth colored and they're really not noticeable. They're just bonded on, just like regular composite bonding would be done, and they are removable. We remove them at the end of the treatment. So once you have those on, we pop in your first set of trays. We make sure you're doing well for the first week. You come back after a week or so just to check up on you and make sure you're doing well with the trays. And we give you 3 to 5 trays to take home with you with the dates on them. You change out the tray on the dates that are specified on the packets. You come back for your checkup appointment. We just track, you know, and move along that sequence. Then finally, when you're done with all the trays, you come back, we take another scan and see where you're at, if we're both happy with where the teeth ended up, and if they look good, the bite is good, everything looks great, and you're happy, we're happy, then we send that scan to make retainers, which are called Vivera, and the retainers are what are going to keep your teeth aligned after the treatment. And that's what you're going to wear at nighttime after you're done the treatment. And we remove the buttons or the attachments, and then we give you the Vivera retainers. You wear those for a year at a time, and we just monitor as time goes on. Yeah, there are older people doing Invisalign. In fact, we've had at least 2 to 3 80-plus-year-olds that have done Invisalign and done it successfully. They look fabulous. Yep. Some dental insurances cover the cost of Invisalign, or at least a part of the Invisalign. Usually I don't see them covering all of the Invisalign. I've seen it maybe once or twice. It depends on your age. Sometimes it's only for dependents under, you know, say age 18 or 19. So it really depends on your insurance, but what we can do is you come in with your insurance information and we'll look it up. We'll see what benefits you have. If you have orthodontic benefits that we can use towards Invisalign, we will most definitely use them, and we will submit all the proper paperwork needed in the background for you to use your insurance benefits. So with the dental insurance, just say you don't have benefits, we still have other options such as financing with Cherry or we have a few different companies that we use, but that basically allows you to apply in the office, and if you get approved, you can have 12 months 0% interest and basically break up your payments, so it's a lot more manageable to pay for your Invisalign.